Assalamu alaikum. Today we will continue to talk about the parts of the extrapyramidal tract. In the first and in the second lecture we talked about the corticospinal and the first part of the extrapyramidal system, which was the nucleus. Today we will continue to talk about these tracts and what is the importance of each tract in functioning together with the corticospinal system. Okay?
In this lecture, we are going to talk about the reticular formation, the types of reticular formation, projection, and their function. We're also going to talk about the vestibular spinal tract and its main function, and also a few notes about the tectospinal tract.
Okay, start first of all, talk about a very important structure called the reticular formation. Okay, what is the reticular formation? It is an interconnecting projection or interconnecting structure containing nuclei that extend throughout the area adjacent to most of the brainstem. As you can see, this is the reticular formation, red in color, and it's like adjacent to most of the brainstem structures from the brain pons and to medulla oblongata. Okay, and it's a projecting structure because it's projected to the cerebrum and to other parts, have a projecting neurons to most of the cerebral cortex and even to basal ganglia, and have also a projecting and descending. Now, the fibers arising from the reticular formation and end at different levels of the spinal cord mainly interconnect with the gamma type of motor neurons in the spinal cord called reticulospinal, okay, called reticulospinal, which are the descending part of reticular formation. Now, reticular formation, they found that it consists of two parts, okay, من شافوا reticular formation, شافوا they had two separated areas. The upper and the larger one called excitatory or facilitatory, okay, we call it facilitatory area, which is the larger and in the uppermost of the reticular formation. This part have a spontaneous discharge, okay, have a spontaneous projecting discharges to the cerebrum and to the cortex, and it's important to maintain a normal muscle tone, okay, and to exert that function it needs help from the other part of the reticular formation, which is called the inhibitory area. It is the smaller and the caudal. Caudal means the part of the lower or the lower part of reticular formation, okay, it is the reverse to rostral. Now, the driving, this part driving by fibers from inhibitory suppressors. هذه not spontaneously firing or projecting. تحتاج إلى impulses when neurons comes from the cerebrum and from the basal ganglia, and it sends an inhibitory strips to the reticular formation to inhibit muscle tone. Okay, so the muscle tone, it's a function of both. We need both excitatory or facilitatory and inhibitory parts of reticular formation to stabilize a normal muscle tone. And you should know what we mean by muscle tone. Muscle tone is the resistance of a muscle to a passive stretch at rest. Now, when we bursting our muscles, not contract our muscles, there is a spontaneous stretching to the muscle. The resistance exerted by, or the resistance of the muscle to this passive stretch at rest called tone. Okay, and it's not the same as strength. Strength is the resistance of a muscle to an active stretch during contraction. This is called strength. The reverse is tone. Tone during rest is a passive stretch, okay? It's called resistance. So this resistance to be maintained in a normal tone, we need the activation and we need the function of both the excitatory or the facilitatory and the inhibitory areas of the reticular formation to balance the tone. Okay, and here we have more clarification on this image. Okay, we can see that this is the brainstem, okay, structures, midbrain, pons, and medulla oblongata, and we can see that the reticular formation, these two circles represent the areas of reticular formation, the bigger and the upper one called the facilitatory or the excitatory, which have a spontaneous firing and projection to most of the cerebrum to maintain the muscle tone, maintain muscle tone, okay. And the second one is the lowest and the smaller one called the inhibitory area. Okay, also this part need for a projecting neurons comes from the cerebrum. So muscle tone is maintained by a balance of function between the facilitatory and the inhibitory areas of reticular formation. Okay. Reticular formation, we need to know that it's another extrapyramidal part, and since it's an extrapyramidal tract, it's like the radionucleus need an orders and need to be functioning well. It needs a controlling system. It needs to be controlled by the upper cerebral cortex and even by basal ganglia. We have a separate lecture talk about basal ganglia. Okay, so let's suppose if the patient had a damage to the extrapyramidal fibers from the cortex and from basal ganglia down to the reticular formation. Okay, it will affect the reticular formation. فإذا صار عندنا damage بالcerebral cortex and the basal ganglia, we will have a problem in the tone regulation. How? Well, there is a damage to these two areas, okay, cerebral cortex and basal ganglia, and we say that these are the controlling systems mainly for the inhibitory areas. They send projecting neurons to the inhibitory area of reticular formation to act together with the facilitatory to maintain muscle tone. So if we have the damage to these two parts, specifically to the extrapyramidal fibers inside these two parts, so this will cause a problem in functioning of the inhibitory area. There is no inhibition for the muscle tone take place. So the facilitatory area will work on the tone only by itself. There is no help by the inhibitory area. There is no control on the inhibition, only excitation, which have a spontaneous discharging in neurons. So the patient will have an excitation and will have increasing in the muscle tone called hypertonia. Hypertonia is a medical term, means that the patient have increasing in the resistance to passive stretch. When the patient in a relaxing state and he's resting, we find that when we try to assess the tone, we have a specific examination test to assess muscle tone. إن شاء الله تاخذوها بعدين بالclinical aspects. نسوي examination to muscle tone and يعني نسوي examination in different joints of the body. We will find that there is an increasing resistance. ما راح تمشي عندنا حركة المفصل بطريقة smooth، أوكي، اللي هي normal نشوفها، راح تكون increased، أوكي، فممكن نسميها عندنا term نسميه بالrigidity، ممكن تكون rigid، أوكي، معناها أكو عندنا زيادة بالmuscle tone. فهاي تصير يصير عندنا damage to the fibers from the extrapyramidal fibers from the cerebral cortex and basal ganglia. وهذه مهمة لعمل واحدة من الفاكتورز المهمة اللي maintaining the muscle tone which is the inhibitory factor. فإذا صار بها impairment راح تشتغل فقط الفاسيلتاتوري فايبر وبالتالي يصير عندنا زيادة بالمسل تون نسميها hypertonia. Okay. This is all you need to know in the second stage about reticular formation. It has many other functions, many regulating functions, but the time and the we can't tell you everything about it in the second year. اللي يحب يعرف informations أخرى للإطلاع أكيد يقدر يرجع للتكست بوك. Okay, لكن هذه information تعتبر enough for you in the second year. Okay. The third part of the extrapyramidal system called vestibular-spinal tract. Okay, vestibular-spinal tract. Vestibular, it comes from the vestibular word. It means the vestibular nuclei. Okay, or vestibular nucleus. You know that the vestibular nucleus, it's the nucleus of the 8th cranial nerve. Okay, in cranial nerve number 8. Okay, and spinal, معناها we have a connection between the vestibular nucleus and the spinal cord called vestibular spinal tract. Okay, this is the brainstem. Okay, and we can see this is the pons and this is the medulla oblongata. Also the 8th cranial nerve nuclei located in these parts. Okay, and have many connections. This nucleus have many connections with the cerebellum, with the spinal cord, and even with the other structures. So it has an important function in maintaining the motor function. Okay. It has a connection with the inner ear, with the cerebellum, basal ganglia, cerebral cortex, reticular formation, and other parts. Have many connections. Okay. We have many nuclei of the vestibular system, okay, many nuclei. Okay, we have a superior one, superior vestibular nucleus, we have inferior vestibular nucleus, okay, and we have a connection between the nuclei and the spinal cord. They divide these divisions into two parts, okay. We have the lateral vestibular spinal tract. Lateral vestibular spinal tract is from the lateral and inferior nuclei, okay. This is the lateral nucleus, okay, and this is the inferior. المفروض الانفيريور تكون عندنا هنا موجودة على الجهة الثانية. فالlateral and inferior together form the lateral vestibular spinal tract, okay. The lateral, this is lateral in red color اللي راح يمشي ويسوي connection with the spinal cord, okay. Whereas the medial vestibular nucleus, this is the medial vestibular nucleus, have a connection with the spinal cord through what's called medial vestibular spinal tract. Medial vestibular spinal tract. Here we need to know that the connection of the vestibular nuclei and the spinal cord have no crossing fibers. That is to say, it will pass ipsilaterally, okay? No crossing or no decussation take place. It will pass on the same side of the. Okay, again, this is a simple diagram. This is a simple picture. Show to us the multiple connections of vestibular nucleus. The vestibular nucleus have connections with the motor cortex, okay, with the visual system, visual cortex, with the vestibular apparatus, vestibular system inside the inner ear, okay, with the cerebellum, okay, in different zones and areas. We have a specific lecture talk about cerebellum, okay, with the reticular formation and the pontomedullary part between the pons and medulla oblongata, okay, and with the proprioceptive system which control the proprioception and the position sense at the neck and the limb, okay, and then it have a connection with the spinal cord, interneurons through what's called vestibular spinal tract, and it's mainly act on the extensors. So why we need all these connections? What is the importance of the vestibular spinal tract? Now, it's important to maintain balance, and when we want to maintain a balance, okay, we need for a visual perception, we need for a perception from the inner ear, we need a good perception from the motor cortex, from the cerebellum. All these connections act together to enhance a good balance, okay. حتى يساعدنا في التوازن نحتاج إلى many connections. So this is the first function, which is very important function. When a patient have an impairment to the connection of the vestibular nuclei, for example, due to impairment of the cerebellum or the visual system, one of the important signs the patient complain from is the loss of balance. يصير البيشنت عنده ataxia نسميها اللي هي loss of balance, okay. فإذا الbalance have many important structures work together to maintain a good posture and a balance when we are standing, okay. Also, it's important to regulate muscle tone, okay, and related to posture. When you have a specific posture, the tone during this posture also need to be maintained by this vestibular spinal tract, and also to respond correctly by recording sensory information from the inner ear, from the hair cells in the inner ear, which is called the labyrinth. So when we have these sensory informations of hearing, also will affect the balance and affect the state of posture of the patient. So when we have a problem in that connection, the patient will also have loss of balance and have a problem. Some patients, they have otitis media or inflammation of the inner ear effect on the fibers connected to vestibular spinal tract. So the patient also will have what's called vertigo, which is also another important sign. Patients feel a sense of rotation of the environment. يبدي يحس إنه environment تلف بيه, okay, it's called vertigo. So this is another important sign. And from this we know the importance of the vestibular spinal tract and the importance of the whole connection to the vestibular nucleus. Okay, these are the three important functions of the vestibular spinal tract. Okay. Okay, another important part of the extrapyramidal system called Tectospinal Tract. Tectospinal. Okay, this tract have a connection in the midbrain. Okay, in an area called superior colliculus. Okay, You can see in this picture we have the midbrain. Okay, this is the midbrain, and we have many structures and nuclei within the midbrain. One of it we familiar already with it, which is called the radionucleus. This is the purple in color. Okay, and this small circle greenish in color called superior colliculus. Okay, هذه superior colliculus عندها pathway or connecting fibers with the spinal cord to form the tectospinal tract. Okay, tectospinal tract. So there is a visual input and visual stimuli comes from the visual cortex to the superior colliculus and send fibers to the spinal cord with a decussation at the midbrain. So we have decussation. It will cross to the opposite side. ليش هذا الكونكشن؟ ليش صار لنا connection between the midbrain, superior colliculus and the spinal cord? Because this is an important pathway or tract, and it's concerned with spinal-visual reflex. Okay, it's important for the reflex to take place in the head and neck in response to visual stimuli. حركة الhead والneck in response to a visual stimulus need for activation of this tract to allow for this movement to occur. Okay, so this is the most important part of this tract. There is a visual stimuli comes from the visual cortex to the superior colliculus, send a projecting fibers to the opposite side to the spinal cord to help in the functioning of a reflex which is called a spinal visual reflex, which is the reflex of our neck and head in response to a visual stimuli. This is called tectospinal tract. Okay, of course we have many other parts of the extrapyramidal system, but we cannot mention all of them. Okay, نحاول نختصر المحاضرة for you. اللي يعني يحب ياخذ details أكثر موجودة بالتكست بوك، لكن هذه enough بالنسبة لكم كinformation. I will just add one slide which is important in clinical practice. We have reflexes. Okay, we have spinal cord reflexes and we have upper motor neuron reflexes. Okay, when you start in the fourth year and enter to the clinical wards, especially in the neurological wards, and face patients have problems in the corticospinal tract, have problem in the motor system in general, you need to perform the reflexes. Okay, the reflex examination. Okay, one of these reflexes, and it's very important, it's called the plantar response reflex or the extensor plantar response, which is one of the upper motor neuron reflexes. Okay, and give us one of the important upper motor neuron signs. Okay, how we can perform this reflex? شلون نسوي هذا الرفلكس إحنا؟ We'll start perform a scratching. Okay, take a blunt sharp object, for example the key. Okay, ناخذ المفتاح ونسوي scratching in the lateral aspect of the sole. Okay, start here, moving toward the middle or the middle of the upper part of the sole. Okay, in this way, a scratching. نسوي scratching in this part. Okay, هذا المفروض يصير عندنا فد upper motor neuron reflex. النورمال reflex شنو يصير عندنا إذا corticospinal tract intact and we have no problem in the corticospinal pyramidal tract. The normal response اللي راح يصير عندنا شنو؟ As you can see on the left side of this image. Okay, when you perform a scratching, the response الطبيعي راح يصير flexion of all toes. Okay, flexion. Okay, down flexion وadduction، يعني يصير عندنا flexion وتقارب بين التوز. هذا normal response. But if the patient have an impairment of the pyramidal tract, he will have another response يسمونه extensor plantar. هسه normal response نسميه plantar response، نسميه plantar flexion. Okay, because we have flexion of the toes. But the patient who have impairment of the corticospinal or pyramidal tract fibers, the upper motor neurons I mean, when you perform a scratching اللي راح يصير عندنا شنو؟ يصير عندنا upgoing of the big toe, upgoing or extended big toe, and abduction or fanning of the other toes. تتفرق ويصير عندنا extension of the big toe ونسميه upgoing يرتفع لي فوق فنسميها extensor plantar response، ولها اسم ثاني يسمونه بابنسكي sign. اوكي، هذا اسمها بابنسكي sign. اللي صار شنو هنا؟ When the patient lost the corticospinal fibers and not intact anymore, البريدومينسي راح يكون الاكشن of the extrapyramidal fibers، فتعطينا abnormal response. فإن هذا الشيء اللي صار الupgoing of the big toe والfanning of the other toes or the abduction It's because of the predominancy of the action of the extrapyramidal fibers, because of the impairment of the pyramidal fibers. فما صار عندنا الnormal response. هذه نسميها بابينسكي sign. هذه sign should be done in or this examination test should be done in every patient suspect to have an upper motor neuron lesion, okay, and clinical practice. فنورمالي هسه الانسان الطبيعي ما عنده مشكله. You can experience this test on your one of your brothers and sisters in the home. تقدرون يجربوها. Take a blunt sharp object, for example the key, and start scratching on the lateral aspect of the sole, okay, move medially, okay, like this picture here, okay. You will find that a normal person have this response. والnormal ما نسميها بابينسكي sign، لا نسميها normal response to plantar flexion response لأن صار عندنا flexion. الابنورماليتي نسميها بابينسكي sign or نقدر نسميها extensor plantar response لأن صار عندنا extension وabduction no flexion and abduction. طبعا of course this response take place in this picture in adults, okay, in adults. بالإنسان البالغ يصير عندنا هذا الريسبونس بهالشكل. لكن الطفل حديث الولادة الجوة السنة خصوصا below 1 year اللي بعد البروسيس اوف مايلينيشن ما كاملة عنده بالكورتيكوسباينال تراكت ينطي ريسبونس شبيه بالبابينسكي ساين لكن نعتبره نورمال، اوكي. فاذا this picture for a baby, okay, below 1 year من نسوي scratching you can see that there is abduction and upgoing or an extension of the picture، وهذا احنا نعتبره abnormal بالادلتس لكن هو normal بالاطفال. ليش؟ لان the process of myelination, the process of development of the upper motor neurons is still not completed، اوكي. فبالتالي ينطي هذا الابنورمال ريسبونس لكن احنا نعتبره نورمال بعمر جوا السنه. واللي عنده طفل بالبيت يقدر يجرب عليه هذه التجربة أيضا ويشوف الريسبونس مالته. Okay, this is all about the extrapyramidal fibers. This is all about the corticospinal tract. We will have another 2 lectures. One talk about the basal ganglia and the other talk about cerebellum in details. If you have any questions, you can write your question in the classroom and I will try to answer you. Thank you for listening and good luck.
Okay, so in summary, we talked about the following extrapyramidal tract. We talked about the radicular formation. We said that it's a set of interconnected nuclei which are located within the brainstem. It have 2 parts, ascending and descending pathways. And also it have 2 areas, one called facilitatory, which maintain the muscle tone, the other called inhibitory. We also talked about other tract, vestibular spinal tract, which is going to maintain balance, maintain tone during posture, and also it's important for the inner ear sensory information. And also about the tectospinal tract, part of the midbrain, which is important for reflex movement of the neck in response to visual stimuli.